Hello everyone, I am Dr. Rashid Hassan, and in this lecture I am going to talk about the composition of different cements used in dentistry. Well, basically I am going to talk about the basic composition of a few of the dental cements, which will be a combination of different powder and liquid system to make it easier to understand and recall. Well, dental cement is a substance that hardens to act as a liner, base, as a varnish, or as a luting material for the cementation of different prostheses, either with the tooth structure or with each other. So it can be used for a variety of applications in the clinical dentistry. So in this lecture, I am going to briefly talk about the basic composition of zinc oxide eugenol cement, zinc phosphate cement, zinc polycarboxylate cement, silicate cement, and glass ionomer cement. The composition of all these cements is basically a combination of powder and liquid components. So just keep in mind the two powder components, zinc oxide and fluoride containing glass cements, basically silicate glass cements. So keep these two powder components in your mind, and the combination of these powder components with different acids or the liquid components is going to give us the composition of various dental cements. So firstly, when zinc oxide powder is mixed with eugenol liquid, it's going to give us zinc oxide eugenol cement. The zinc oxide eugenol cement has various clinical applications in dentistry. For example, it can be used as a long-term or as a short-term luting agent. It can also be used as a temporary restorative material or as an intermediate restorative material. It can also be used for making surgical packs, and it can also be used as a root canal sealing material. So this combination of zinc oxide with eugenol liquid is going to give us zinc oxide eugenol cement. The same zinc oxide powder, when mixed with phosphoric acid, is going to give us zinc phosphate cement. So the powder component remained the same, zinc oxide powder. We just changed the liquid component, which is the phosphoric acid, and the cement that we got is zinc phosphate cement. This zinc phosphate cement has a variety of clinical applications. Like due to its high compressive strength, it is used as a base under the amalgam restorative materials, since it can withstand the high condensation forces during its placement. Secondly, it is a good thermal and electrical insulator, so it is very effective in reducing the galvanic shock induced by the dissimilar metallic restorations. Then zinc phosphate cement has relatively low solubility as compared to the glass ionomer cement and zinc oxide eugenol cement, so it is a very stable cement in oral cavity. Now, when we mix the zinc oxide powder with polyacrylic acid, the composition changes entirely, and the cement that we get is zinc polycarboxylate cement. This zinc polycarboxylate cement has a variety of applications, like as it can be used as a luting cement for the base alloy restorations. It can be used as a thermal insulating base under the direct metallic restorations. It can also be used for the cementation of orthodontic bands, for the cementation of the stainless steel pediatric crowns. So what we see here, that we kept the zinc oxide powder constant and we just changed the liquid component, and we got three different types of dental cements: zinc oxide eugenol cement, zinc phosphate cement, and zinc polycarboxylate cement. Now coming to the second type of the powder component, which is fluoride containing glass powder. When we mix fluoride containing silicate glass powder with phosphoric acid, we get silicate cement. Well, this silicate cement has anti-carcinogenic property, and it was initially used as a tooth-colored restorative material due to its translucency. The same fluoride-containing silicate glass powder, when mixed with polyacrylic acid, gives us glass ionomer cement. The glass ionomer cement is very popular in the restorative dentistry because of its vast variety of clinical applications. Like it can be used for the cementation of inlays, crowns, bridges, and several orthodontic appliances. It can also be used as a restorative material, as a liner, as a base, and it can also be used as a pit and fissure sealant. So, in a nutshell, we can say that by changing the combination of different powder and liquid components, we can get different types of dental cements. So, that was a brief lecture about the basic composition of few of the dental cements. I hope it was helpful. Thank you very much. Take care.